Unlike any other countries, Japan came to know about the outbreak since December beginning. But Japan has a challenge of Tokyo Olympics 2020, so do their actions too, but did not utter to outside about the real impact of CCP virus yet, and the voice of Taiwan was suppressed by Chinese government and WHO officials like Dr. Tedros. Japan started taking measures by discontinuing the rail services from Wuhan and start collecting their citizens from Wuhan since December, and sprayed new combination of disinfectant in possible inlets. But in January, some 925,000 Chinese people traveled to Japan, while another 89,000 made the trip in February. Responding to the coronavirus pandemic, the Japanese government closed all schools 2 weeks before the spring holidays at the end of March, and cancelled all public events. But shops and restaurants could remain open, and few Japanese employees decided to work from home. When the epidemic broke out in a primary school on the northern island of Hokkaido, authorities closed all schools in the prefecture and declared a state of emergency. After 3 weeks, the spread of the virus had been stopped. The low numbers of confirmed COVID-19 cases in Japan initially aroused suspicion that the government was covering up the truth. Barbara Holthus, a sociologist with the German Institute for Japanese Studies in Tokyo, said that after the Fukushima nuclear disaster in 2011, the government initially refused to admit the reactor meltdowns. Today, there remains a great distrust of official statements. Masahiro Kami, a virologist at the Medical Governance Research Institute, reported that despite having the capacity to make 6,000 diagnostic tests per day, Japan has only tested around 14,000 swabs to date, 20 times fewer than neighboring South Korea, which has been hit hard by the pandemic. Only patients with the most severe symptoms are tested, means the number of unreported cases is very high. Political scientist Koichi Nakano added that Prime Minister Shinzo Abe likely wanted to present Japan as a safe country in order not to lose the Summer Olympics, though the International Olympic Committee ended up postponing the event anyway, and Japan has not conducted extensive coronavirus testing, especially in comparison to countries such as South Korea and Italy, which have aggressively tested people for the virus. Compared to the number of tests conducted in South Korea, with half the population of Japan done, more than 510,000 so far, the number in Japan has been just over 60,000 for 126 million people. The small number of tests was due to the slow bureaucratic response, which was also seen in the poor crisis management by the Ministry of Health, Labor and Welfare of the Diamond Princess case. The suspicion was that the government had conducted only a small number of tests in Japan to hide the scope and severity of the infection, partly due to the Shinzo Abe determination to hold the 2020 Olympics in Tokyo. Tokyo's governor, Yuriko Koike, is poised to call for further business closures to contain the coronavirus outbreak, setting her on a collision course with the Prime Minister Shinzo Abe. Koike said that asking for residents to use self-restraint and stay home is not enough, soon after Shinzo Abe declared a state of emergency this week, and should also restrict the use of cluster-causing facilities such as restaurants and karaoke parlors. The governor is expected to list the categories of shops and other non-essential businesses, with 4,257 infections and 92 deaths. Japan has avoided the devastation seen in China, the US and parts of Europe, but a recent surge in Tokyo, with 1,339 reported cases, and other major cities forced a reluctant Shinzo Abe into making the emergency declaration. Japan reported more than 500 new positive cases of novel coronavirus for the first time the 9th of April, just after the Tokyo Olympics were postponed, and the new cases reporting were of no contact history in Japan, hints a near outbreak. It points to both hygiene fatigue after 3 months, and due to inadequate test